Members, it is the appointed time and a quorum has been formed. I call to order today's meeting, that is the meeting of the Subcommittee on the issue relating to policy on monitoring child protection agencies. This marks the third meeting of this subcommittee. Today's discussion will center upon manpower planning and service planning. I now invite the administration to come in. When they are seated, I will invite the Undersecretary to speak first. Members who would like to speak, please press the Request to Speak button in front of you. On today's items, the Secretariat has prepared background briefs to facilitate discussion. That is CB brackets 225/2024-02. And I invite the Undersecretary for Labour and Welfare, Mr. Ho Kai-ming, to brief us on the papers prepared by the government, CB brackets 225/1. And then you may put questions to the government. In view of the number of members today, I'm aware some members are outside Hong Kong, so I will give you more time, 5 minutes each. Mr. Ho Kai-ming, please. Thank you, Chair. Members, the government attaches great importance to the care needs of the children and youth receiving residential care services, and has noted the difficulties and pressure faced by frontline workers in caring for them, especially charges with special needs. In this regard, the government continues to implement measures and allocate additional resources to strengthen RCCS, that is Residential Child Care Services, including increasing the salaries of qualified child care workers or CCWs to retain them, and strengthening support to RCCS by professionals to alleviate the pressure faced by frontline workers. Over the past 10 years, we have increased allocation of resources multiple times. Please refer to Annex 1 of the paper. In 2022 April, we have established a committee on review of residential child care and related services chaired by the Director of Social Welfare to conduct review on residential child care and related services in 2 phases. The recommendations include strengthening manpower deployment, introducing professional support, and strengthening training. Now, these are the progresses. We are following up on the implementation of the measures, including allocating $56.7 million in this year, and allocate some $80 million annually from 2024 to 25 onwards to implement the recommendations on improving the manning ratio of CCWs. Also, concerning recommendations put forth in the report of the second phase review on providing additional support to foster families with children with special learning or care needs, including arranging early assessments and appropriate professional rehabilitation therapy and training. Starting October 2023, we have provided additional resources for RCCCs, or Residential Special Child Care Centers, for strengthening manpower and introducing professional support, including enhancing the manning ratio of CCWs, creating the post of childcare aides or CCA, increasing the manpower of social workers, nurses, clinical educational psychologists, health workers, and child care staff, and upgrading the rank of superintendents. Now, for every 100 children, the manning ratio will be enhanced from 1.6 to 0.2 to 1 to 5. Now, we are providing on-site rehabilitation services to the residents of RCCCs who are assessed to have special needs and have been waitlisting for preschool rehabilitation services. And we have allocated additional resources for organizations operating RCCCs to procure on-site medical services so that children can receive appropriate medical services in the centers. On collaboration with the sector, we are exploring strategies to provide training on staff to care for children with special needs as well as caring for children in crisis. We are enabling social work students to have more in-depth understanding of LCCCs and encouraging them to join the service after graduation. We encourage child care staff to undergo continuous training to identify possible abuse of children. We are also enhancing monitoring of work quality. Now, we are including elements of child protection in the contents of the existing pre-employment training programs for CCWs. We welcome members' views. We will listen carefully and respond to members' views. Thank you. Thank you, Under-Secretary. We will first invite members' views on the recommendations put forward by the report. 3 members have pressed the button. Dr. Frankie Ngan. Thank you, Chair. Under-Secretary, you mentioned that resources were increased for supporting organizations to hire more staff. But we heard that it is very difficult to hire staff, and the wastage rate is very high. So I want to know the vacancy ratio in these organizations and the wastage rate in the sector. And what plans do the governments have to attract more new blood into the sector? What about a financial incentive to encourage staff to stay on? I would defer the question to my team. Please switch on the Deputy Director of Social Welfare's mic. Thank you. All along, we have been enhancing training for childcare workers and also the manning ratio. We learned from the trade that after the enhanced training regime, they have more confidence in offering quality services. Now, besides our regular inspection, we are also involving the justices of the peace as well as the private sector in conducting these inspections. The frontline workers are more confident in their work. And the inspection revealed that the sector is doing better in terms of abuse prevention. True, there is considerable wastage, but we do see that the organizations are able to fill up the vacancies left behind by staff turnover. NGOs don't have much trouble or difficulties hiring alternative manpower. Dr. Frankie Ngan, are you unable to provide us with the statistics? Do you not have a survey at all? Well, like Dr. Teck Chi-Yuen told us, and the sector told us, they have a hard time hiring people to fill up the vacancies. And would you consider financial incentives for encouraging newcomers to stay? We don't have the figure right now. According to the service providers, there is a wave of turnover. Since we have enhanced financial provisions for the organizations, they should have no problem hiring staff. It just takes time. On hiring and retention bonuses, We do offer flexibility under the lump sum grant subvention system through offering bonuses. Quality workers would be encouraged to stay. By utilizing this flexibility, service providers can continue to enhance their manpower situation. Undersecretary, you told us that the sector told you that there is no issue in hiring. Is that true? Turnover does exist. However, after enhancing the remuneration package and demanding ratio, with time, they are able to fill up the vacancies left behind by resigners. But the picture painted by the sector to us is not that positive. The turnover rate is so high that they have difficulty filling up the positions. Without statistics, we cannot drop a targeted plan for demanding ratio. We don't have the figures right now, but we do carry out regular inspection. We don't think that the current manpower situation cannot meet the statutory requirements. Dr. Tick, I want to highlight the plight faced by the sector. They really have difficulties hiring. According to the standard, they must meet a certain manning ratio, otherwise that would be illegal. Now, the operators are hiring just anyone who can breathe. That's the situation. They are not being picky in hiring. I just talked to the sector 2 days ago. Social workers would rather not work as RCCCs because the stress and pressure is immense. Now, the report led to another situation. The monitoring requirements or supervisory requirements was extended to 24 hours. That's good. We saw some child abuse cases before in society, so we wanted to enhance quality of child care. Prevention of abuse is one facet of that. We want to care for the development of the children. A task force was established by the government back then. Me, the chair, and Mr. Bill Tang were involved in the task force. I think the report is the product of mass consultation. That's good. I hope the government would involve the sector more. On the mandatory reporting of child abuses, you have consulted a lot of professionals. That's great. But I think you have to involve the sector more in drafting the manual. Now back to this topic. The first issue is hiring difficulties. We have to face that. Second, a number of recommendations were made in the report. We support that. The Undersecretary said resources were set aside for that purposes. Great, but tell us the timetable and how will the resources be distributed. We need to hire social workers, supervisors, and also aides. Yes, training is good. It would enhance service quality. But what about the establishment? Now, I believe you are going to offer more recurrent funding to the sector. So how By how much can you enhance the manning ratio? And the timetable, please.
Undersecretary, I will invite the Deputy Director to tell us more about the timetable and other details. Here, one comment from me. Dr. Tick's question has to do with the changes in manpower in the social welfare sector. As Dr. Tick will be aware, it's hard to hire full-time workers. Many young people become slashers these days. The ratio will be better 1 to 5, but it will be an 8-hour job. It's a tough work. So if it turns into a slasher job, this may get greater interest. At elderly care homes, more people apply for part-time positions. Some firms also offer this kind of job. We're still looking to see if the slasher model can be applied to children's agencies. At elderly care homes, there are different kinds of helpers, but with residential childcare services, we have an all-local workforce. It's hard to get outside workers from outside Hong Kong to work at children's agencies. It's hard to have imported workers. And also, let's remember, young people prefer becoming slashers, so hiring will be tough. Sure, there is a way to hire workers. We will get someone after a recruitment exercise. But there may be expectations and considerations over the pay and other considerations. Dr. Tick, the entire sector is struggling. I believe this labor crunch is common to all sectors in Hong Kong. But just to comment on one thing, I hope the government can note the difficulty in the sector. At children's protection agencies, they are struggling more than the other parts of the social welfare sector. I would just like to draw greater attention to this area. And on the planning, I would like the government to tell us more. Deputy Director of Social Welfare. I thank Dr. Tick for his question. The resources are there. In 2023 to 24, the funding has gone up. Starting from 2024 to 25, the annual allocation is $80 million. As Dr. Tick was saying, the funding is indeed recurrent in nature. On the detailed manpower allocation, the Assistant Director, Ms. Wendy Chow, can tell us more. Dr. Tick made a good point. At the review committee, members focused on manpower in the sector. We had a lengthy discussion on that point. So when manpower is involved, more resources may help or other forms of support may help. As the Deputy Director just said, last year we secured the resources. So starting from October last year, for residential childcare centers and also our SCCCs, we gave these centers more resources for a few things. First, more childcare workers. The ratio will go up from 1.6 to 6.2 to 1.25. We will also have childcare aides or CCAs. Childcare workers are busy. We may not be able to hire all the CC workers we need, so we have childcare aides such as taking children to toilets or helping replace diapers that can help ease the workload on childcare workers. We will also have more social workers. For the post of superintendent, we will upgrade the rank. It used to be a chief social welfare worker. It used to be a chief assistant social welfare worker, but we are raising it to a social worker level in the light of the higher requirements for this post. For social welfare assistants, we will have more such assistants. The professional support will also help. Apart from more nurses, we provide greater professional support for on-site rehabilitation. More manpower aside, there's another point we discussed at the review committee. We also asked the care homes to work on training and manpower planning. So the care homes have to work on staff development. You need a good environment to attract workers to join this place. So we want the care homes to get the training right. They need to give the staff the skills and expertise. That way, new staff with the training will stay at the care home or the child protection agency. As the members just proposed, they wondered if we can promote these jobs to students so that these students consider finding work with the childcare agencies or care homes. We're working with education institutes. We talk to social welfare students. We tell them about these jobs so that when they make a career decision, they can consider joining this trade. So we have taken follow-up actions in a number of ways based on members' comments. Madam Chair, one comment. The trade or the sector would like to see something more specific. Now we will see more social workers, and the superintendent will see an upgrading in rank. But there's little on what's for nurses and social workers. We don't have a timetable on when the resources will go to the units. Can we get a written reply from the government on this point after the meeting? Just then I mentioned resources that have already been allocated to the units starting from last October. So the units already have the resources. They can hire the workers they need. Dr. Tick, if you have follow-up questions, you can ask them for the second round. Ms. Lillian Kwok. I have a few questions touching on different areas. I want to ask about the practicalities. Can the government tell us, say you receive a case involving a child, the child goes to an institution. The government told us they would assess the conditions promptly and then give the proper support. How is that assessment done? And after the assessment, what will be done about the support? Can the government tell us more about the workflow? Deputy Director. We have case workers. Once they get a case, they consider the conditions of the family involved, the needs of the child, and then they decide the kind of service to provide. Sometimes support for the parents is good enough, but in other cases, a family may not be able to give the proper care for the child for the time being, and institutional care may be needed. And then we consider the age and the behavior, the psychological well-being of the child, and then we pick the suitable institutional service for the child. In other cases, suspected child abuse is involved. Here, multidisciplinary meetings are held. At these meetings, the members discuss what to do. We look at the assessment from the professionals at that meeting, and then we provide the suitable service based on the assessment. Before the child goes into institutional care, we approach the institution. So we give the institution the background details of the child so that the institution gets a sense of what the child needs. After the child goes to the institution, the caseworker also talks to the social worker at the institution because they need to draw up the long-term welfare plan. The child stays at the institution. The social workers need to figure out the support they need. The social workers also need to follow up on the needs of the parents while the child is at the institution. So there is regular review and assessment for social workers to decide on what to do about the child. After the long-term welfare plan is in place, we follow up accordingly. And then we decide whether adjustments are needed and discharge arrangements are made during our regular review. Thank you. I raised this question for a reason. Now, I was involved in those meetings too. The social welfare department coordinates the matters. The caseworkers and social workers collect input from professionals. At this point, I do see issues. Has the view from the institution been engaged? Some children are sent to an institution and then they realize it's a wrong place, so the child gets sent to a different place, and then this goes on and on. I had this case of primary 6 student who had been to 5 different institutions. We know there are emergency institutional care. That's for short-term care. But for some children, they are stuck for a month or 2 waiting for emergency institutional care. That's why I want to find out about the workflow. First, on assessment, do we have a standardized approach to assessment? Different experts, professionals are involved in assessment. Let's look at seniors. They have a certain method for assessment. A trained social worker assesses the conditions of a senior and then finds a suitable care home for the senior. Can we apply this model to children? Can we standardize the assessment? Of course, flexibility is needed since we are assessing human beings. But on this basis, can we have some form of standardization so that we can find the right care for children in a timely way? This is something I would like the government to give thought to. On the last point raised by Ms. Wendy Chow, after institutional care is over, there is the transitioning process. That's where issues come up. The institution may provide follow-up for up to 1 year by a social worker. And then afterwards, the matter goes to the social worker at the Integrated Family Service Center or social workers elsewhere. This applies to people who are discharged after they turn 18. Now, the follow-up may last 6 to 12 months, but these are people struggling with issues. They have needs. Their minds are not at ease. Some may adapt faster than others, but for those who need more time to adjust to their new life, and the follow-up is just 6 to 12 months, and then these children or young people are expected to adapt to a new life. I know the government has finite resources. Can we have a longer period of overlap between the institution's social worker and the outside social worker? This way, the social worker, either at the Integrated Family Service Center or at the SWD, will have greater success in taking over the case. This is where problems come up. When young people struggle at this stage, they suffer for the rest of their life. Some time ago, we heard a case from the Correctional Services Department. There are young offenders at CSD's institutions. Some of these young people were at an institution at one point. They were fine at the institution or at school, but something went wrong during the transition as they entered their post-discharge life. So my 2 points, discharge and the transition.
The crux of the 3 questions is that a mismatch would mean a bad future for the children. Director? Thank you. In terms of assessment, we have been training up our frontline workers to conduct assessments. We have staff members from Integrated Family Services Center. We also have colleagues from the Probation Office, as well as Family Protection Unit. All of our staff members would undergo regular training on assessments. For each child welfare case, the deputy and the district social welfare officer would review the situation of each case half a year. Most of our cases are removed from their family because of transitional family issues. So once those issues are gone, they can be placed back with their original families. Sometimes the parents get sick or are institutionalized. Or maybe because of a change in marital status, the welfare plan for the children have to change. So sometimes these children will have to be put in institutional care. Young people may experience emotional or behavioral changes. So for these cases, we have to consider housing them in another institution. But the principle is to minimize the number of changes, because each change would cause stress on the family and the youth. It would cause emotional stress on them. This is something that our staff understand clearly. For youth experiencing behavioral problems, they would receive help on site. However, if their emotional issues cause an effect on other residents, then we may consider relocating them to another institution. That is a decision to be made by the caseworker and the social welfare officer on what's best for the child in question. If there is no alternative, we may have to relocate the child. For youth reaching the age of 18, we would provide follow-up service for half a year to a year after discharge. Referral services would also be offered to the charge. For example, to the Integrated Family Service Center, and also the probation office will also be involved if there is a need. Accommodation or residential care service may be offered to youth after the age of 18. There are also units in the private sector to follow up on cases with needs. We would make concrete plans for each case. Just now, the official spends 5 minutes to elaborate his answer, but still my question was not answered. Will you enhance our assessment mechanism so that before offering a place to the child in question, we would consider which environment is the best for him or her? For example, for children with special education needs, we should first consider institutions with more SEND children. Different institutions have different training regimes and focuses for their social workers. On professional assessment, would you invite the homes to conduct an assessment on the child first to see whether the child is suitable to live in that environment? Well, sometimes for children with no mental needs, they wouldn't want to be put in a home with a lot of autistic children or children with mental needs. The parents don't want that as well. So we should widen the scope of assessments to minimize the need for relocating the child in the future. Now, on providing transitional services, there should be ongoing review involving various disciplines, but I think the duration should be much more than 1 year. I suggest 3 years. There are children being discharged at the age of 11 or 12. They need constant follow-ups. So the care homes should stay on the case for a longer period of time and communicate better with the social worker. Undersecretary, allow me to elaborate on 2 points. Now, for small group homes or RCCCs for children with special needs, they are not mental institutions. We do train the frontline staff on providing the suitable care for children. Now, for small group homes, the children in these homes may have various health issues, so we allocate more resources to these small group homes. But we shouldn't cause a stigmatizing effect by conducting additional assessments. Now, for institutions with the capacity, they should offer a more comprehensive service. If there are separate questionnaires on whether there are special needs attached to the children, or that may cause a labeling effect. Most of the children living in care homes have learning difficulties or special education needs. So if we conduct a separate set of assessments for an organization, it may send a message that this institution only takes a certain kind of children. So we don't want organizations to select which children should receive care from them. Chair, I was merely quoting what the children told me. These are not my own words, as well as that of the parents. Parents told me these in their own words. Now, I have seen cases in Polancook or School for Social Development. We have seen many children with different education needs. I'm not trying to label these children. We just want to maximize the resources allocated to them for their development needs. I think there is room for adjustments in terms of the mechanism. I will follow it up in my next round. Deputy Director, thank you. I support what you said. We shouldn't stigmatize the service units. The majority of children having undergone residential care do see significant improvements in their self-control and behavior and emotions. For children requiring residential care, it is usually because of changes in the family setting, for example, change in marital status or change in relationship in the family. So it would cause the self-esteem of these children to plunge. So we do see testing out behavior exhibited by these children after they are admitted. They think that they are being abandoned by the parents, so they want to test if others are abandoning them as well. We do conduct admission interviews on each case. The referral social worker and our case manager would sit down and draw up the best welfare plan for the child to help him overcome his psychological issue and adjust to the new home setting. Now, for larger institutions, they have a hostel parents or a dorm parents. They would take care of the physical and emotional needs of the cases. On discharge service, may I invite my colleague to speak. Now, RCCC service is different from residential care service for elderly people. We need close monitoring of the case from admission to discharge. The social workers will be involved every step of the way. The case will not be handled by the care homes alone after the referral. With the changes in family and also when the child grows, the needs will change drastically. So we need close communication between the care units and the social worker. Now, one recommendation made by the committee is to enhance the function of a case manager. The case social worker will double up as the case manager and keep in touch with the care units to understand the latest situation of the child and also keep in contact with the family to improve their caring skills. There must be regular meetings between the case manager and the social worker to assess the latest changes in family and draw up a discharge plan. On discharge, the case manager must also ensure that the child can transition smoothly into a family life or living on his own. There must be unbroken contact with the case. So at present, every child would receive an interview before changing institution. Before admission, the care unit would conduct an assessment on the case. So after the interview, a care unit may refuse to take in a child because they don't think they are able to help him. That is a possibility. The care units would read the information we give them, and then they would meet with the child. If it is found to be suitable, they would set a time for admission.
Ms. Kwok may speak for a second round, so let's move to Referent Peter Kun. Thank you, Madam Chair. The sector and I care about child care agencies, especially family-based care. The sector has brought up hiring difficulties. One reason is the low pay. They believe the pay is not attractive enough. I believe the government is aware of the problem. Some foster parents do the work out of empathy. They are compassionate. Other foster parents want to finish the cases they have at hand and they will leave. This has to do with more than money, but money can help. In the past, the appeal lay in the provision of public housing. But this incentive may no longer be attractive now. I know the government is in a squeeze. But the incentive for foster parents is really on the low side. Now I turn to manning ratio. The best ratio to have is 1 to 4. That may not be achievable in the short term. But in the long term, can the government tell us clearly whether they would work towards this direction? The 1 to 8 ratio will not get us far. The current ratio of 1 to 8, or a better version, 1 to 6. So one area, I'm wondering if there can be any relaxation, and that has to do with residential care, staying overnight. The father usually has to work. Foreign domestic helpers are out of the question. Now we call these foster families, but they're not really families in the sense that they can hire FDHs. Many families hire foreign domestic helpers. Now this matter falls under the Labor and Welfare Bureau. I know the government may not be able to give an answer right away. This has to do with the definition of domestic helpers. But if possible, relaxing this rule can help foster families. Staying overnight is where the strain lies. Something may go wrong when the child stays overnight. I know the government may not be able to offer a promise here and now, but this is a direction the government should explore. Can we have maybe a couple of workers helping look after the child, help out? It's hard to have just a couple look after 8 children at a time. Now, the 18-year limit. So someone at the age of 18 may still be in secondary school. At many small group homes, from my experience, we have kind-hearted people. They find places for those aged over 18 to live. We recover the cost. These are young people who need help in their growth. We don't want to create this service gap when these young people are turning 18. Of course, we want these young people to be able to land a student hostel place when they enter university. But during this transition, these young people are thrown in at the deep end. They panic. Of course, a transition is going to happen sooner or later. But can we extend the service a bit to cover the point young people turn 18? There is keen demand. Service places are in short supply. We just have 3 to 4 service units. Each unit covers 5 children. That's just 20 to 30 children in total, but that's far from enough. I hope the government can give me a response on this. Deputy Director. Thank you. I thank Reverend Kun for his question. On hiring problems, the government has been reviewing resources for residential childcare services. Over the years, in January 2019, 2020, there were multiple occasions when the pay and manning ratio were reviewed at these childcare agencies. On the pay, we have raised the midpoint pay for childcare workers. We have raised it by 2 points. At a small group home for a welfare worker, the average pay is $29,000 per month. That's just the midpoint pay. Some get paid more, though entry-level staff may get paid less. We believe this is competitive pay in the market. Now, on manpower, there's a house parent at every small group home. Each house parent looks after 8 children. But there are also welfare workers supporting the house parent. So the manning ratio is this. For every 8 children, there will be 3 1/3 welfare workers on average to look after the 8 children. We have heard from the sector, and we've looked at the sector's operational need. We believe the pay and the manpower can help service units plan their human resources. As the Undersecretary said, every sector faces the problem of staff turnover. But for social welfare units, they can hire enough people to run the service unit. For the follow-up work, I will invite Ms. Wendy Chow to tell us more. Now, for children's residential child care services, it covers children up to the age of 18. As Reverend Kun was saying, young people who are about to turn 18, they are sitting their diploma of secondary education exams. In some of these cases, the case workers talk to social workers. We look at the family conditions of a child. It's a transition. If we think it's not a good idea for the child to go to a new environment, we allow flexibility of a short-term stay for that child or young person. Once this child is assessed to be in the right condition, then the child goes home or goes on to other long-term welfare schemes. So here, the caseworker talks to the other social workers to make the proper arrangements. We already have this kind of arrangement in place. Madam Chair, just then, the Deputy Director talked about the staff ratio. He has counted in the welfare workers, the social workers. But there's just one person looking after the children overnight. There are 3 children small group homes, 3 clusters rather than. There are 10 welfare workers. So on average for each small group home apart from the house parent, there are 2 1/3 welfare workers to look after the 8 children. Do the workers stay overnight? So they do stay overnight. But there's just one house parent overnight. The biggest challenge lies in the overnight period. It's 1 to 8. children may fall ill, they need to be hospitalized. That happens overnight. The manning ratio applies to the daytime, right? Now, for small group homes, they offer round-the-clock service. We need more people than 128 because we have to consider that SGHs run round-the-clock service. So there are 10 welfare workers for every 24 children. So for every 8 children, there are more than 3 workers for each small group home. This is for the small group home to provide round-the-clock service. We need enough people to care for the children. For most small group homes, they have at least one person keeping an eye. During daytime, they have more workers around. Apart from the house parent, there are other support workers at the SGH to help look after the children during the day. On deployment, the service unit has flexibility in deploying the manpower. There is support from welfare workers and social workers. The service unit can deploy the manpower based on its need in looking after the children. Chairman, it's about a figure. From what I know, for small group homes, there is just a couple. You cannot find someone else to look after the children overnight. That's why I was saying, can we have one couple look after just 4 children? Now, the government told us there are more than 3 people looking after every 8 children. But imagine overnight 1 child falls sick. That's enough to overwhelm the worker. This should be more than a numbers game. The house parents cannot cope with the work overnight. The government has been saying there's enough manpower, but the sector has told us the opposite. Reverend Kun mentioned foreign domestic helpers. Now, I will put this question by using my own slot. Just then, the government told us child care differs from elderly care because for elderly care, imported workers can be hired to help. But in child care, no imported workers are available. That's why Reverend Kun mentioned foreign domestic helpers. So can the government tell us, can we look at the possibility of imported labor? What are some thoughts you have had? What are some challenges? Undersecretary, the SWD can tell us more about this. Now, on childcare, let's look at foster families and small group homes. At a foster family, the care happens at the home of a foster family. Here you have a real family, so the foster parents can hire a foreign domestic helper. That's fine. But at small group homes, it works like a hostel. It's a workplace. Even when a small group home looks like a family, it's an institutional care facility. That's a challenge that prevents the immigration department from allowing foreign domestic helpers. But we can look at this. So small group homes are different from children's homes after all. But there is a challenge. We can look at this. We can have a discussion. Small group homes are similar to a family setting. The house parents may be a real couple, but the setting is not the real family. But we can certainly look at what can be done. And let's see if the Social Welfare Department has anything to add on this point. On domestic helpers, the Undersecretary has given a reply. Foster families can hire foreign domestic helpers. Now, on the overnight stay at small group homes, welfare workers can stay overnight. say a parent falls sick, or a child just admitted to an SGH has adjustment issues. So the slot for two and a third workers do allow a spot for welfare workers to stay to help. Now, usually the house parent, the man has work. We have allowances for welfare workers to stand in as the house parent. So when needed, there can be relief house parents to look after the children.
係咁
Reverend Kuhn, I get it, but you have to understand, one couple taking care of 8 children is too much. Imagine if only one of them gets sick. If you require a helper to stay overnight, that would make it more difficult to find a candidate. At night, as you said, the husband has to work. So if a child develops a fever, then you have to take him to the A&E, then you have to spend the whole night waiting to see a doctor. That's the whole night gone. From what I learned from foster parents, or just any parents, they think 4 children is the maximum. If you ask anyone in society, they will tell you 8 is an unimaginable figure. So please think about this. This has been dragged on for years. So at least enhance the ratio to 1 couple to 6 children. I understand the shortage of space and so on, but at least get the figure down to 6. Well, the sector is not indignant, so to speak, but they are really tired of this. When can we enhance the ratio from 1 to 8 to 1 to 6 and then 1 to 4? The sector would really love to learn the timetable to achieving that. Well, let's continue. Dr. Tick and Ms. Lillian Kwok have follow-up questions. Dr. Tick, second round. I shall be brief. It is understandable that every child in need of institutional care has a very sad story behind him or her. So please forgive us for pestering you to enhance the welfare service for these children. Now, I applaud the government for allocating some $80 million each year to enhance manning ratio or manpower for RCCCs. In operation, what frontline workers feel may be different from what you say. So that's the reality. So in terms of enhancing training and enhancing the manning ratio, please talk to the frontline workers. A year has passed since the report has come about, and the situation has changed a lot. Now, SEN children accounts for more than half of the children in RCCCs, and more than 30% have experienced domestic violence. So I hope it is not like before when we have a report, then we call it a day and leave it there untouched for 10 years. Now, the unit cost has increased much because of the more complicated nature of the case. So can you enhance the funding for each case? And for cases with special needs like SEN, would there be special allowances for the care units to hire helpers? Well, I am in a hurry to leave, so I would like to speak on the next item as well. So please, can I have 1 minute to ask my question first? So the next item is about service planning. Now we are moving towards the direction of small foster families. We are enhancing recruitment and resources allocated to foster families. So I applaud all these. So besides moving towards small scale foster families, can we encourage care homes to adopt a small family model? Now, in the future, public housing estate will set aside 5% of GFA for childcare facilities. So can we establish childcare facilities under the small family model? Thank you. Thank you, Dr. Tick, Undersecretary. Thank you, Chair, and thank you, Dr. Tick, for your questions. I would invite the Social Welfare Department to elaborate on the details. On the 5% GFA's uses, we are still planning the uses. We will come back to you later when we have a concrete plan. We try not to relocate children in RCCCs. Drawing on the reference from the management of RCHD, residential care home for elderly people, we also try to prevent moving the elderly people as well between nursing homes. Now, for elderly people with dementia and other ailments, we are offering more allowances to the care units. Same applies to children with special needs like SEN. We are offering more resources to the carers in terms of financial support and manpower support. That is the direction we are moving towards. So I invite the Deputy Director to elaborate. Thank you, Dr. Tick, and thank you, Undersecretary. As mentioned by Mr. Ho, for the 5% GFA for welfare facilities, we will maximize the use of the space. We have reached out to some service units. For childcare facilities, we are planning to introduce a small-scale services with a maximum capacity of 48 children. Now, for larger care homes with more than 100 children living in them, they are also running it under a family model. 8 to 10 children would be put under a small group for better care and closer relationship between the children themselves. On manpower, I thank Dr. Tick and the chair for participating in our committee on review. Yes, the cases are getting more complicated. Family situations are getting more complicated. There are more SEN children and there are more trauma. So having learned all that from you, we have a more solid ground for fighting for more resources to enhance the manpower in our CCCs. So besides salary enhancements and better career future, we have also secured resources to provide ancillary support to small group homes and foster families. A lot of children have emotional needs, so we have secured more resources to help these care units to purchase psychological services for the children. Ms. Lillian Kwok, I appreciate that the government's acknowledgement that the majority of children in care have SAN needs. So that's why I suggested a separate assessment for them. I'm not trying to label them. Of course, upon assessment, we have to enhance the manpower to give them the needs to give them the help they need. I've been working with care homes for a long time. Now in small group homes, the manning ratio is 1 to 24. For schools, the teaching students ratio in classrooms has been enhanced to 1 to 12. But for small group homes, it is still 1 to 24. This sector would really like to know the timetable for manning ratio enhancement, especially for large-scale homes, especially when we have more and more SAN students. In the past, we didn't have so many autistic students in schools and in care homes. Now, they are telling me the percentage of SAN or autistic children has risen to 30 to 40%. It is adding to the pressure of frontline social workers. Now, we are always talking about the three-tier emergency care services with tripartite collaboration. Now, we don't have enough clinical psychologists, clinical educational psychologists as we speak. Now, for social worker, that service falls under Tier 1. The three-tier model is a universally accepted model. Now, this three-tier emergency model, advocated by the Health Bureau and the Education Bureau, is something that the world has been using for a long time. We understand that schools are at the core of the model. They are the go-betweens. On the other hand, in a small group home setting, the frontline staff workers in small group homes are the center. We have to engage them as go-betweens whenever there is an issue. So how can we enhance the linkages between Tier 3 and Tier 2? For example, arts therapists, musical therapists, and counselors. Can they fill in the gap between Tier 2 and Tier 3 and have more play? Third, about manpower. Have you conducted a review on the manpower deployments in small group homes and care homes? We have suspended increase to the establishments of small group homes for quite some time. Still, we want to offer a family-like setting to children to encourage healthy development. Children are being bounced back and forth between small group homes and care homes and other institutions. So we have to conduct another round of review on the manpower deployments and number of quota places among these institutions. And I wonder if you trace the trajectory of the cases after discharge, how many children would fall back into the judicial system. Say, for example, how many discharged cases would commit a crime and then be incarcerated. These data would be very useful in terms of formulating an enhancement plan for the service.
副局長。
Undersecretary or Deputy Director. I thank Ms. Kwok for her questions. On manpower, based on the review committee's recommendations, we have two parts to the plan. First, for residential childcare services and also residential services for children with special needs. We have secured resources for more manpower at these services. At our CCCs, demanding ratio of childcare workers has gone up from 1 to 6.2 to 1 to 1.5. And for the night, it has gone up from 1 to 12 to 1 to 8. For frontline staff, we will have childcare aides. There will be more nurses, clinical psychologists, educational psychologists. We will have more such professionals. There is also on-site rehabilitation. For phase 2, we will stick to the recommendations. We are trying to secure resources for work on several fronts. First, more frontline workers, and also enhancing their professionalism, and also more health workers to meet the healthcare needs of children, more clerical assistants, more workmen to step up, administrative and general support. We are in a process trying to secure more resources to get this extra manpower. With more workers, then we can have better support for the residential services. Now, on the manpower review, I will invite my colleague to tell us more. Ms. Kwok made a good point. She raised the three-tier response mechanism. Where appropriate, we can apply this three-tiered structure. To take a small group home as an example, now there are frontline workers and house parents. They know how the children are doing. They can deal with the daily needs of children. There are also social workers to provide support. Professional support is needed sometimes, so the social worker can come in by following up the needs of the children. We also have resources for an agency-based enhancement scheme for professional support. Some children have special needs. These children may be already receiving support from the hospital authority, but the children may have to wait for the services. That's why we have funding for the children's agencies to procure psychological services or social work services to meet the needs of the children by providing early assessment. So at different points, we provide support for children and young people. On manpower planning, on children's care agencies, children have different needs. We encourage family-based care for children. But for some children, because they're of their own or their family conditions, they may be better suited for institutional care. We have plans to set up a residential child care center in Tuen Mun. For some families, their children may be more suited for residential childcare centers. We will work towards setting up another childcare center in the future. Just then, we also mentioned family-based institutional care. The small group homes are already doing that. The 3 clusters of child small group homes are looked at as a whole. We try to put the small group homes together so that we can achieve synergy. This applies to support from social workers. And the service units will also have greater flexibility in deploying resources and moving children. For different development projects, we will set aside space for small group homes. Sorry, Madam Chair, let me clarify a point. The 3-tiered support structure allows flexibility. This means the service unit can procure outside service such as counseling, art therapy, play therapy, music therapy at Tier 2. Is that the case? Now, it's mostly about clinical psychology service, but this belongs to level 3. Not everyone needs clinical psychologist. Some need service at the middle. That's why we have a 3-tiered service. The 3-tiered system has been around in other parts of the world for many years. It's the same with primary healthcare. Our primary healthcare removes psychology from it. Since service units buy outside service anyway, can the government give service units a room to procure the proper service for children? Then we can talk to the social welfare sector. We have the resources. Now, our focus is on social workers and clinical psychologists. We can look at whether the resources allow us to have other kinds of services. The question is simple. Let's have fewer restrictions and more flexibility for the service units to pick and choose. If we can do that, that will meet the needs of children at small group homes. That will give greater support and greater flexibility for small group homes. So we have already jumped to the item about service planning. Ms. Kwok, do you have other follow-up questions about manpower? We need to give time to the Undersecretary to walk us through the paper. Another point about manpower. When can we expect a timetable? At some agencies, the manning ratio is 1 to 24. The staff there are under immense stress. I want a timetable. So we all agree there's a need for a timetable. So I hope the government can provide a timetable promptly on manpower deployment. At the review committee, we discussed this point. At different agencies on having more frontline workers, improving the manpower ratio, those points are covered in the review report. Based on the resources, we will look at the way forward. It's all about resources. Last year, we got the resources for residential childcare services. That's why in last October, we managed to make the resources available. Now, based on the recommendations of the review report and the resources we have, we will follow up accordingly. Let me put the question differently. The sector has looked at the review report. They want to know the priorities of the items. Which of the items in the report are priority items? The sector wants to know how long it will take the government to deliver the items in the review report. Let me respond to this question. If no extra resources are involved, we have started to follow up on those items. On items involving funding, we are arranging the resources for the service units. On other items involving extra resources, we will look at the resource allocation and then take things forward one step at a time. So for items that do not involve extra resources, we have started the follow-up. Madam Chair, the government has started the follow-up work. Can the government give us a paper on the follow-up work that has already started to give us a sense of the plans for manpower? Now, since manpower is involved, what are some changes? What are some plans? Can the government give us a paper setting out those information? At the last meeting, we discussed enhancing childcare. We have covered that point at the last meeting. This meeting is about service planning, so we haven't covered the progress. At the last meeting, we did cover the progress. So we may not have anything new to add on top of what we gave at the last meeting. I'm looking at work that's coming up. The different parts of the information go hand in hand. Madam Chair, I don't quite get Ms. Kwok's question. Let me finish the sentence. Now, we have already allocated the resources to NGOs. It would take the service units time to hire the people, so we cannot ask those service units to give us a timetable. But for the work already done, we have given the information in the paper from the last meeting. So I would like some clarity on the question. Madam Chair, I thank the Undersecretary for his response. My point is this. The Labor and Welfare Bureau has given more resources for training, more resources for, say, psychologists. The Education Bureau also provides input. For the social welfare sector, there's manpower. We will have more health workers at childcare agencies. This is for human resources. So in the year to come, what will be done? What changes would there be in manpower? And in the next 3 to 5 years, what are some goals? 10 years from now may be too far away, but let's look at 3 to 5 years from now. Some students may graduate. Can the government show us the way forward? Can the government at least show us that the manning ratio is going down to give graduating students some hope? Just then, several members raised the point about the timetable. Members want to know when things will happen, given that the recommendations are there. Early during this meeting, members asked for data on manpower. The Deputy Director said he did not have the data at hand, so can you provide the data after the meeting? Can we have more specifics for members' reference? We have also touched on some items under service planning, that is under the paper serial number 03. I will give you the time to walk us through the paper for service planning. Madam Chair, I now walk members through the latest progress on service planning. Now, the goal of childcare services is to support and strengthen families so that a suitable environment can be provided to facilitate the comprehensive development of children on the physical, emotional, and social aspects, and guided by the service vision of child-centered, family-focused, and community-based to prioritize the needs and well-being of children and ensure that children receive suitable care and protection. The government attaches importance to service planning of child care service. This includes case management, post-discharge support, and service deployment and interfacing. While receiving child care, the children will have caseworkers follow up on their situation. The caseworkers and social workers serving the families will hold regular case meetings as they continuously review the needs of the children. They provide proper service for the children and families involved. This includes counseling, family life education, parent-child activities, and referral to suitable services. so that the families are in a better position to care for the children. Caseworkers also work with the children involved and facilitate early family reunion where conditions permit. I will now come to the follow-up actions on redevelopment of premises. We will increase surface places through redevelopment projects. The preparations are underway. In the Eastern District, there will be 3 small group homes. There will be 100 foster care places in Tuen Mun. We will have a residential childcare center. We have a special site scheme for welfare premises. Through that scheme, we will have a residential childcare center and a children's reception center. The long-term goal is that in 2035 to 36, surface places will go up from 4,275 to 6,336, up 50%. The Social Welfare Department will continuously review the usage of childcare service centers and the range admission. The SWD will work with the departments and bureaus involved in deploying resources to meet the needs of children who need residential care. A review committee has been set up to review case management and other aspects to come up with enhancement measures. The SWD will encourage childcare units to stick to the homeschool cooperation model in continuously caring for children with special needs. For foster care services, starting from April this year, the incentive pay will go up from $5,000 to more than $11,000 for non-emergency foster. For emergency foster care, this incentive will go up from $6,600 to $13,000. There will be extra support for foster families of children with special educational needs. There will be flexibility in recruitment of foster families, so that foster families can take part in the training. This is to encourage more people to sign up for foster families. The government will continue to follow up and review the delivery of the enhancement measures and work with the different stakeholders to better protect children's well-being. We welcome comments from members. Many members have spoken on this aspect. We will continue to respond to members' questions. Thank you.
好多喺頭先上
Many issues were covered in the previous item. I do see Ms. Lillian Kwok's hand, so please continue. Thank you. Concerning service planning, I have some new ideas. I wonder if you would consider my suggestions. Now, we have noticed some babies requiring hospitalization after they are born. There are many newly born babies in hospital waitlisting for a place in care homes. Now, I've just looked up the hospital authorities' website for infants. The waiting time can be as long as 9 months. During that time, they would be remaining in hospitals. According to overseas studies, the development, the period between 0 and 9 months old is the golden period for learning and development. A lack of development planning for children in this age would cause significant learning delay. We know there is a huge shortage of care places for newborn babies. The need is some 300 per year, but we only have 100 places each year. So in terms of care plans for babies, can we enhance collaboration between the hospitals and the care homes? Social workers should reach out to babies waitlisting for a place in hospital and formulate a development plan for them that can minimize the occurrence of learning delay in the future and thus lessen our burden in the future. Ms. Kwok, are you asking about the number of caring places for babies still in hospital? Well, we understand that there is a long-term insufficiency for residential childcare centers or residential creches places for children under 3. But maybe during that waiting time, social workers can reach out to infants still in hospitals. They spend most of the time in beds, so it would cause serious delay to the development of their motor skills and other abilities. And then this would cause cases of SEN, which is more nurture than nature. So if we can do that, we can reduce our spending in this regard. So do we have care places for babies in a home setting? I believe these are rare cases. I mean, babies requiring institutional services. So we do have a residential creches. We also have residential creches providing emergency services. In this year, for residential creches, we have 139 service quotas. The usage rate is 87%, but according to the document, it says 159%. That's including emergency care services, and then the usage rate is 159%. Emergency services do not require a waiting list. The overall usage of our care services for babies is some 87%. Well, it depends on the total number of cases, so I would defer to the social welfare department for more details. Well, there are some cases where the mother abandoned their babies, so we will increase the emergency service places from 20 to 32 for babies in need. I invite the social welfare department to elaborate. Deputy Director, thank you. For residential creches, the usage rate is 87%, according to the Under Secretary. Well, as Ms. Wendy Chow said, we plan to increase the number of service quotas. In the Twin Moon residential creches, we will increase the number by 48. We are also identifying a suitable place in the Kowloon area for building a residential creches with another 48 places. For emergency services, besides residential creches, foster families are also an option for caring newborn babies in need. In year 2023 to 24, we have 20 new emergency fostering quotas. This year, we will be able to put these 20 additional quotas to use. Now, the cases mentioned by Ms. Lilian Kwok may be special cases. For residential crèches with facilities for babies with special needs, the waiting time on average is 3.6 months. So the cases waiting for more than 9 months mentioned by Ms. Lilian Kwok might be the minority. So in the long run, we will ramp up the supply of these services. For special cases requiring long-term hospitalization, it is more probable that the child requires special medical care before he or she can be put into the care of service units. Thank you, Chair, and thank you, Administration. The data I quoted were from the hospital authority. So as a matter of fact, I know there are babies stranded in hospital. I don't know what you refer to, Deputy Director. I'm referring to newborn babies with Down SEN diagnosis who in the end developed learning delays because of the long duration of stay in beds in hospitals.
So
these are the cases with arrested development. So for newborn babies remaining in hospital, can you provide on-site rehabilitation services in hospital to help them? Deputy Director, as I mentioned, the average wait for a place in residential crèches is 3.6 months. For cases remaining that long a period in hospital, it is most likely due to their own medical issues. So in terms of referring babies sooner to the care units, it really depends on the actual healthcare needs of the baby. It varies case by case in terms of the shortest time required to refer a baby to the care unit. We have to make a distinction between babies waiting in hospital because there is a lack of service place, or babies requiring to be hospitalized because of healthcare needs. If there is already a service place offered, but the baby is still required to be hospitalized because of healthcare needs, would you be able to offer on-site rehabilitation services at hospitals to the baby? I think that's what Ms. Lilian Kwok tried to ask. And also the administration has been talking about residential crèches with special with facilities caring for babies with special needs. Well, but I'm talking about the general situation. On average, there are stranded cases staying in hospital for 9 to 12 months. So for babies waiting for a placement with development needs, can you provide on-site outreaching services in hospitals? Well, I don't think this is the appropriate platform to discuss individual cases. May I suggest a discussion with Ms. Lilian Kwok together with Mr. Alex Wong on these individual cases. We have to involve the families in question as well. So may I suggest reaching out to you after the meeting? Sorry, Chair, this is not a case-by-case discussion. This is a policy matter. I'm asking whether you can do this for cases of this nature. There is such a need. So I'm asking whether the social welfare department is in a position to offer rehabilitation services to these babies. Well, like I said, we have 20 service quotas for fostering babies. And this year we will add another 32, so altogether 52. For emergency cases, and if the babies are suitable for transferring out from hospital, then they will be transferred to residential crèches with the capacity to care for them. Otherwise, they would have to wait for a few months. So that's how we plan. I'm not in a position to answer whether outreaching services can be provided to babies in individual hospitals, but I will reach out to Ms. Lian Kwok afterwards. Do we not have reach out services in hospitals? And we have 20 emergency service quotas. We don't know whether the babies have medical needs, that's why they are stranded in hospital. They are already cared for by doctors in hospitals, so I wonder whether there is additional need for the child to be cared for by other professionals. So between the age of 0 to 6 at 0 and 6 months, they don't have educational needs. They just need some pleasant distractions in bed to stimulate them. So that's the needs we are talking about in that age. Thank you.
主席，
Madam Chair, the Undersecretary said he would look into this point. The government is making a greater effort on the work for babies. 300 babies need the service, but there are just 100 or so places, so there's a gap. The government needs to get started. We don't have enough service places. But we all want children to be able to grow up in a normal condition. There are different schools, play therapy at the pediatric units of hospitals and schools. But for children below 3, we don't have services, especially for babies on the waiting list for service. So I would like to know if there would be on-site rehabilitation. But I thank the government for saying that they will look into this possibility. For me, I want to follow up on some figures. We just discussed crashes. We talked about the average usage ratio. The deputy director said the ratio is 87%, emergency service 89%. In Chun Mun, there will be more service places. I see just the average figures from the Social Welfare Department. I think that lacks focus. Can the SWD give me a breakdown, a detailed breakdown? Say for the 87%, can we have a breakdown by region in the form of a paper? At the Subcommittee on Elderly Care, we raised this point. Some districts see a shortage in service, while other districts see a surplus. So I'm just using this as an analogy. Service availability varies from one district to another. So here I would like to see detailed breakdown for the average usage. Just then, a member brought up a case. A primary 6 student had 5 switches. The child was referred to 5 different childcare agencies. The figures do not tell us that kind of situation. So if the government has the detailed figures, can the government give us a detailed breakdown? In our future discussions about resource allocation, service planning, we need more detailed figures. Average figures cannot help us take a detailed and targeted approach. Under Secretary, we don't have breakdown figures by district for childcare, but for elderly care homes, seniors get to choose care homes from different districts. That's why in elderly care, we have the waiting list by district. We can provide a breakdown in elderly care. But for child care, we don't have the breakdown. So we don't have the figures, the breakdown. I was just giving you an example. We have case managers. The case managers will know what happened to each case, say how long the child has stayed at an institution, how many agencies the child has been to. Do you have the details? If you have the details, please share the details instead of just giving us an average figure. Now, for residential childcare services, the figures tend to be smaller. For residential services, there are 130 such centers. For residential childcare services for special children with special needs, there are 122 places. We don't have the breakdown figures by district. This is where it differs from elderly care. In elderly care, there are 30,000 service places. In elderly care, we can have breakdowns by district. There is the waiting time and other figures. We can look into the average stay at an agency through analysis so that we can arrive at the turnover figures, etc. We just had an in-depth discussion about manpower planning. We need to look at the manpower, and then we also need the other figures to help match the children with the services they need. Average figures are not helpful when we are dealing with children who are referred to different agencies repeatedly. And this is not fair to childcare agencies that look after children with special needs. So we need more data. We don't mind long papers, but we do hope the Social Welfare Department can give us papers showing us detailed figures that will help us get to the crux of the matter. So that's my comment. We spent 2 hours discussing these items. I thank the government departments for joining us, and for the work on the current state of affairs of children's residential childcare and also service surveillance, monitoring, service planning, manpower planning. I thank the government for explaining the work to us. The work on this front needs to continue. Let's redouble the effort. Let's keep working on this, and let's keep engaging on this matter and work for our children. Thank you.
係
Some figures. Members asked the government to provide us with a paper after the meeting on some figures. Will the clerk please follow up? Thank you. If there are no other comments, this is our last meeting I thank everyone for your support. If you would like the government to provide a written response, please send them to the clerk. The clerk will follow up. And once the clerk gets the government's response, they will circulate the response. Now, once the draft report of this subcommittee is ready, we will circulate the draft among members for your endorsement. If there is no other business, I adjourn the meeting here. Thank you.